Good morning, everyone. We're coming live here from David Chapel Missionary Baptist Church in Texas. Excited you have joined us this morning because we have some great information to share with you. Our pastor is Pastor Joseph C. Parker, Jr., Esquire, and he has allowed the Women's Enrichment Ministry to bring information to you that will not only help you, but also the community. My name is Coletta Haskin, and I'm the Women's Enrichment Ministry Director. Our presenter today is going to be Miss Jakki Davis-Dozier, and she's going to bring to you information concerning Medicare and Social Security, and insurance as well, because there's open enrollment. And these are things that you need to know no matter what age you are. So we're going to get started, and I'm going to bring up Miss Jakki Davis-Dozier.
Thank you. Thank you so much. Good morning, everybody. I'm Jakki Davis-Dozier. I'm a licensed clinical social worker in Texas and a bunch of other states. And I am real excited to be here this morning to talk about Medicare, Social Security, a little bit about insurance. I come to this particular place of teaching classes on Medicare kind of organically. I have spent the majority of my career in medical social work, and so I've had to learn about Medicare so that I can explain it, not only understand it for myself, but also be able to explain it to families and to the patients that come into the hospital. And so today, we're going to spend most of the time talking about Medicare. There's going to be a little bit about Social Security and how they kind of work together. But before we jump into that, let me thank the Women's Enrichment Ministry for inviting me to come. I had not planned on doing anything with Medicare this year, but y'all asked, and so here I am. And so this is going to go really, really quickly. I am positive that all of your questions will not be answered, but by the time you leave here, it is hoped that you will be able to at least know who to call when you have questions about Medicare. We do not want you calling Joe Namath, Danny Glover, or anybody off TV to get your answers. So we're going to get started with Medicare. And before we do that, and let me just say that we're going to have to ask the IT guys to move the slides along for us, but that's okay. But before we do anything, question. Who knows? And if you've been to my class before, you know the answer, so don't answer it. But who was the president that signed Medicare into law? Just a question. Anybody? Any ideas? From the audience. And on the virtual space, if you have an idea, you can put it in the chat, Rance. Very good, very good. LBJ, Lyndon Baines Johnson, that guy right there. That's Jackie and Johnson in Puerto Rico. On July 30th, 1965, President Johnson traveled to the Truman Library in Independence, Missouri, to sign Medicare into law. So that president from the great state of Texas did that. Now, next question. Who was the first Medicare recipient? No, it wasn't Deacon Griffin either. I gave y'all the answer in what I said about where he traveled to. He traveled to the Truman Library in Independence, Missouri. So it was Harry S. Truman. And the reason that he was the one that received the first Medicare card is because for many, many years, he had wanted to put together a health insurance program for seniors. So he was the first recipient, and then the second one was his wife, Bess. So just a little history for you. It's always important to know where your actual benefits come from. So those came from President Johnson. All right. So then what is Medicare? It's a good question. What is Medicare? Well, Medicare is health insurance for people who are 65 and over, certain people with disabilities, and people of any age who have end-stage renal disease, necessitating either a kidney transplant or dialysis. So that's the people that can get Medicare. All right. And to get Medicare, you must be a U.S. citizen or you have to be lawfully admitted into the United States. You have and reside for 5 continuous years. So lawfully admitted, reside for 5 continuous years. So nobody's getting any benefits that they did not deserve, no matter what they tell you on the TV about that. All right. So what are the agencies that are responsible for Medicare? Social Security. They're going to enroll the majority of people into Medicare, and we'll talk a little bit about that. And then the Railroad Retirement Board. You might know people that retired from the railroad. They get their Medicare through the Railroad Retirement Board. The Office of Personnel Management for federal employees, and then the Centers for Medicare and Medicaid Services. They kind of set the policies for Medicare and for Medicaid. So Social Security enrolls the majority of people into Medicare. So what exactly is Social Security? Well, you all know. It's a federal program in the United States that provides retirement benefits, it provides disability income to qualified individuals as well as their spouses, the children, and their survivors. It's officially known as the Old Age Survivors and Disability Insurance Program. So if you look at your paycheck and you see that OASDI, that's the Social Security money that you're paying into your Social Security bank. And of course, it's administered by the Social Security Administration. So what you really need to know about Social Security and Medicare, and I know you can't really see that, is that you qualify for Medicare by paying into Social Security. So if you pay into Social Security, you have to have, to get Medicare, you need 10 years of Social Security earnings. And you need to have 1 quarter for 4 quarters a year. So 4 times 10. So 40 quarters of Medicare coverage to get your Social Security for free under Part A. So that means that if you worked from the time you were 20 till you were 30, and you worked for 10 years, and you had 40 quarters, and you never worked again, you would still be able to get Medicare and Social Security when you retired, because it's your lifetime earnings. So you have to have at least 10 years of earnings to get enough Medicare quarters to not have to pay for Part A. And believe it or not, there are some people that don't have 10 years of earnings. I've met them. Okay, so that's all I'm going to say about Social Security, other than do not go to the Social Security office if you have not filed your taxes, because they're going to send you straight to the IRS. So make sure that you have filed your taxes, because they need to know how much you have paid into the Social Security system. So file your taxes and then go to the Social Security office. Also, if you are somebody that has not paid your back child support, do not go to the Social Security office, because you're going to be 78 paying child support out of your $1,200 Social Security check. So do the right thing. That's just an FYI. I've seen that situation too. All right, so what are the parts of Medicare? I know you guys have heard about Part C on TV, the Medicare helpline, the Medicare hotline. Well, let's talk about Part A, Part B, and Part D first. So Part A is your hospital insurance. And I said earlier that if you have enough Medicare quarters, at least 10 years of work, then that's free to you. Part B is your medical insurance, and I don't know why they called it medical versus hospital, but medical insurance, meaning it's your outpatient services, your doctors, your medical equipment, things like that. And then Part D is the drug coverage. And if you guys remember, for the longest time, Medicare didn't have any drug coverage. That didn't start till 2006 with the Medicare Modernization Act. All right. When you're trying to decide what you want to do for Medicare, next slide, please. There you go. Your Medicare options are going to be Original Medicare. That's your red, white, and blue card. That's what President Johnson signed into law back in 1965. So Original Medicare, which is Part A and Part B. You can add the drug coverage, which is Part D. And you can also add a supplemental known as a Medigap. All of that you can add to Original Medicare. The other option is what you keep hearing them talk about on TV, the Medicare helpline, the hotline, Joe name it, call this person, call that celebrity. Those are the Medicare Advantage plans, Part C. Now, there's a reason that they're trying to encourage you to sign up for this. Every time you turn the TV on, there's a commercial about Medicare. I called Medicare, and they looked up my zip code and said, I qualify for this and I qualify for that. We're going to talk about why they're so excited to get you to sign up for these plans once we talk a little bit more about Medicare Advantage plans. But Medicare Advantage plans essentially are you saying to an insurance company, whether that's Humana, Aetna, United, Cigna, I want you to manage my Medicare benefits for me. I want you to tell me when I can use them and when I can't. That's Medicare Part C. And so with Medicare Part C, you're going to have Part A and Part B. You have to have those. It may include Part D, which is the drug coverage. It may not, but it may. Most of them do. And then there are going to be some extra benefits. And that's what people are getting so excited about, the extra benefits, over-the-counter benefit. Got some transportation, gave me some dental, some vision, some hearing, all of that. Well, there's some trade-offs with that, and we will talk about that a little bit later. So those are your options for Medicare. Original Medicare, red, white, and blue card. Medicare Advantage, Humana Medicare Advantage, Aetna Medicare Advantage, Cigna Medicare Advantage, AARP. Those are the Part C plans that they're trying to encourage you to call to sign up for. And I read recently that more people are in the Advantage plans now than in original Medicare. All right, so what's the difference? So in original Medicare, you can go to any doctor in the United States. You can be in California, you can be in Texas. You take your red, white, and blue card, you go to that doctor if he takes Medicare. In a Medicare Advantage plan, you're in a network. So if you get sick in California and your doctor's in Texas, you've got to do a whole lot of authorizing and referring and making sure you can be seen the way that you need to be seen with the Medicare Advantage plan. In original Medicare, you don't usually need a referral. In the Advantage plans, the Part C, you're more than likely going to need a referral, especially if you're in an HMO versus a PPO. So if you're in an HMO, you will always need referrals to see a specialist. So you can't just say, I want to go see this endocrinologist and go. Your primary care doctor has to say, we're going to refer you to Dr. Casaban or whomever. So that's how that works. It's just like your commercial insurance that you have at work right now. You have to have referrals pretty much for everything. All right, in original Medicare, the Part B services are usually about 20% of your cost. So Medicare pays 80%, you pay 20%. In the Advantage plans, it could vary. Original Medicare, you have a Part B premium. Everybody has a Part B premium. Some people don't pay it, but because there are special programs that'll pay it. But everybody has to pay for Part B. And we'll talk a little bit more about how much that is. In an Advantage plan, not only do you pay for Part B, but you may also have a premium for that plan. It just depends on the plan. So you could be paying your Part B premium, which you'll always have, and in addition to that, you could be paying a premium to have that plan. With original Medicare, you can get a Medigap, which is a supplemental to help you, and in the Advantage plans, you cannot, because it wouldn't work with an Advantage plan to have a Medicare supplemental. Original Medicare covers most medically necessary services, hospitals, doctors, medical equipment, clinics, things like that. The Advantage plans may add some benefits that people think are always worth having this. You got some hearing, you got some dental, you got some over-the-counter, those kinds of things. And then with original Medicare, you have to join a separate Part D plan, and in the Advantage plans, it may already be in there. All right, so how do you get Medicare? Who enrolls you in Medicare? Well, some people automatically get Medicare. So if you say you at 62 decided I'm going to retire at 62 and start getting your Social Security check. Well, you're not going to get Medicare yet because you have to be 65 to get Medicare. But because you are getting a check, Medicare will Social Security actually, will automatically enroll you into Medicare when you turn 65. So about 3 months before you turn 65, you'll get your little packet in the mail. And then people that are getting Social Security disability benefits, after they've been disabled for about 2 years, about 24 months, then they're eligible to get their Social Security as well. So, their Medicare as well. So they don't have to do anything. It's automatic. So you get this Get Ready for Medicare. 2023. You get that little package. And then some people have to take action to sign up for Medicare. So like me, for instance, if I wanted to get Medicare, I'm still working. I'm not getting a Social Security check yet. So if I wanted Medicare, I'd have to actually go online. I encourage everybody to have an online Social Security account. Go online and apply for Medicare Part A and Part B or whatever I wanted, because I'm not getting a Social Security check. Now, if I wanted to do that to get Part B, because there is a premium and the money doesn't come out of my check automatically because I don't have a check from Social Security, then I would have to pay every 3 months. I would have to pay the money directly to Medicare, Social Security, somewhere in Wilkes-Barre, Pennsylvania. That's all I remember. So you have to pay it quarterly, yourself directly. All right. So if I wanted to get Medicare, I'm 65, I'm going to go ahead and I don't have any insurance, I'm going to go ahead and get my Medicare. I can start applying for that 3 months before I turn 65. So my birthday was in April. I could have applied in January. And then by the time April rolled around, I would have a card that says I have Medicare effective April 1st, even though my birthday is April the 5th. It's always going to be the first day of the month, the effective date, and then I could start using that Medicare card. I also could apply during the month of my birthday and 3 months after. Okay. Your Medicare card looks like this. That's the red, white, and blue card. So if you have this as your insurance and you don't have any managed plan, this is what you use to go to the doctor, Part A and Part B. The numbers are really weird now. It used to be your Social Security number, and we could kind of figure out people's Social Security numbers by looking at their Medicare card when I first worked in the hospital. And then you could tell if they were getting their own money, if they were getting it from a spouse, if it was a child, just based on the letter that was behind the Social Security number. But then, what happened? Internet theft and cyberware and identity theft and all of that happened. So about 4 years ago, Social Security changed the numbers to these really weird numbers that nobody can figure out how they came up with them. The only thing I know is that the last two things on there are numbers. That's all I can remember. But that's what it looks like. Red, white, and blue card. I always tell my patients, because they get confused, like, the one with the bird on it. So the one with the bird on it is your Medicare. Is your Medicare card. All righty. So if you got your card and you decided, well, I really don't need Part B, and there are some reasons that people don't need Part B right away, you would just send the card back and to Social Security, say, I just want Part A for now, because Part A is free. Part B is going to cost you. So if you just want Part A for now, you send it back. They send you a card, and your card comes back with the Part A only on there. And if you Part A will work as a supplemental to your group coverage. So if you just wanted Part A to back up your group, you could use that. All right, so if you don't already have Medicare, which I don't already have Medicare, I have missed my initial enrollment period because I turned 65 in April, and I had until July, I think, to get it during the initial enrollment period, but I'm not getting it because I have Blue Cross Blue Shield right now. So you can apply for it if you want to do it when you're 65. I'm going to go ahead and get my insurance 3 months before you turn 65. The month that you turn 65, 3 months after that. You could have a special enrollment period, which is what I'm going to have. You could do it during the general enrollment period, which is January 1st through March 31st of each year, or doing open enrollment. So you know that's coming up. That's October 15th through December the 7th of every year is open enrollment. Or you could do it during a Medicare Advantage open enrollment. I know it's all confusing, but I'll explain a little bit more. So the 7-month period, I'm turning 65. I'm going to go ahead and get my Medicare because it may not be around when I'm 66. I'm going to go ahead and get it now. So you have a 7-month period, 3 months before your birthday, the month of your birthday, 3 months after your birthday. If you sign up the 3 months before, it's effective the first day of the month of your birth. And then if you sign up 3 months after, it's going to be effective the month after you sign up. So if I signed up in May, it would be effective in June. It's kind of weird, but that's how it works. All right. Special enrollment periods. People that have group insurance, like you, Rands, you might turn 65 and decide you don't want to get your Medicare yet. So once your group coverage ends, like whatever you have right now, that ends. You have a job, it's going to end. You could sign up for Part A and Part B. You don't have to. You might want to just sign up for Part A because it's free. But you definitely want to not miss signing up for Part B. You have 8 months after you stop working or the group coverage ends. So 8 months, that's a special enrollment period. And there's a special form that you have to take to your Human Resources Department, which I actually brought a copy of, so that they can certify that you did have coverage during the time that you were eligible for Medicare, although you didn't get the Medicare when you were first eligible. And the reason you want to do that is because if you miss the enrollment period and you don't have a good reason, you're going to pay a penalty. And you're going to pay a penalty for the rest of your life, unless you're lucky enough to get Medicaid, which you won't be. You make too much money. You won't get it. All right. So you can sign up for the Part A or the Part B anytime you're still covered by the group health plan or during the 8-month period that begins the month after the employment ends or the coverage ends. I know it's confusing. That's why I gave you all these papers to read. And I'm going to give you a number to call at the end. And then, of course, the yearly enrollment period is starting they just gave y'all the answer. October 7th, 15th through the 7th. All right, so we're going to check our knowledge, but they check the knowledge for you. So let's check our knowledge. Why is your initial enrollment period important? They told you the answer. All of those reasons. Missed enrollment deadlines could result in penalties. It's your first opportunity to sign up for Medicare. And when you sign up impacts when your coverage begins. So all of those reasons are why you do not want to miss your initial enrollment period unless you have a good reason to miss it, like I'm still working. So I missed my initial enrollment period because I'm still working, but I'm going to have a special one. All righty, let's move on to, all right, Part A. What does Part A cover? Part A is your hospital coverage, and that's going to cover anything in the hospital building, inside the building. Well, there are some exclusions, but mostly it's going to be inpatient care in a hospital. That's any kind of hospital. That could be Cornerstone, that could be Brack's no longer a hospital, Dale Seton Medical Center at the University of Texas. That could be Central Texas Rehab. That could be Shoal Creek Psychiatric Hospital. That's covered under Part A. Your meals, nursing care, the medications that you receive, other hospital services. And at the bottom it says inpatient care in a skilled nursing facility, and let me clarify what that means. So a skilled nursing facility is a skilled nursing is a type of care that you receive in a building that's typically a nursing home. Medicare does not pay for nursing home care, so you will never get Medicare to pay for you to go to a nursing home. But Medicare will pay for you to go to and receive care at a facility that provides skilled care inside of the building that's the nursing home. So it's going to be places like where you used to work, Falcon Ridge Nursing and Rehab, Park Bend Nursing and Rehab, Southwood Care Center, Pflugerville Care Center. So people that go to places like that, they say, oh, Medicare paid for me to go. Yeah, they did. They paid for them to have skilled care inside of that facility. And the way that Medicare, there are some qualifiers. So you have to have a 3-midnight stay, 3 midnights in a hospital as an inpatient. That means you're not in the emergency room and you're not coded as observation, which means we're just trying to figure out what's wrong with you and we don't know, but you're not an inpatient. So your status has to be inpatient. So when you go to the hospital, like, am I inpatient or I'm in observation? Because it makes a difference. So if you've been in there 3 midnights and they say, okay, you need a period of continuing physical therapy, you could go to a skilled nursing facility if that was what the therapist assessed was your level of need. And Medicare would pay for you to do that. First 20 days would be no copay. After day 21 to 100, you would have some copays. Okay, it also covers hospice, home health, blood, And as I said, most people will not pay a premium for Part A because you've got those 10 years. You work from 20 to 30. You got 10 years of Medicare coverage, so you're not going to pay a premium. People that have to pay a premium for Medicare, and some teachers do, that have to pay a premium for Medicare, it's kind of expensive. It's probably about $400, almost $500 a month now. So it's worth it to have worked those 10 years. All right, so you won't pay a premium, but if you don't sign up when you're first eligible, and there's no reason that you qualify to not sign up, then you're going to pay a penalty when you do sign up, and it could be as high as 10% added on to the premium, which is $500. All right, so what you pay in original Medicare in 2023 for Part A. So you go to the hospital, the very first $1,600, you owe it. After that, day 1 through 60, you have no copay. Hopefully you won't be in the hospital for 2 months, but if you are, you wouldn't have any co-insurance after that. And then there's some additional amounts that you would pay after day 60. Same thing for mental health care, because as we said, a mental hospital is a hospital too. All right, home health care. So home health care, in order to get home health care, we're not talking about home health aides. We're talking about you need skilled care from a nurse, a therapist, a skilled social worker, a nurse, something like that. Home health care is really a good deal, I think, because there's no copay. So if you need home health care, there's no copay for home health care, but you do have to be homebound, which means it would be very difficult for you to go to a doctor. Not that you couldn't go to a doctor, but it would be a severe and taxing effort for you to get out of your house and go there. So homebound is the first thing, and then if you are able to qualify, then you have no copays. The people come into your house. The opposite of that is outpatient therapy, where if you go to Seton outpatient rehab, then you're going to have a copay, usually about $25 per visit. All right, you have benefit periods. We're not going to talk much about that. Just know that you can have multiple benefit periods in original Medicare. It starts when you go into the hospital, and your benefit period ends after you've been out of the hospital for 60 days in a row. That's the end of it. So you can have 2 or 3 benefit periods. So every time you go into the hospital, it's a new benefit period. It's a new $1,600 deductible for 2023. All right, do I need to sign up for Part A? Well, it's free for most people. If it's not free for you, you can pay for it. You probably don't want to do that. And then if you're actively working, talk to your benefits administrator about when is the best time for you to do that. And then another important thing that I found out is that if you have a health savings account, which a lot of people do with their insurance plans, if you have a health savings account and you're getting ready to sign up for Medicare, you have to stop putting money in that health savings account 6 months before you sign up for Medicare. Yeah, so, or you're going to have some tax penalties with the IRS. So if you have a health savings account, Jakki does, then you have to stop putting money in that 6 months before. And the reason they say is because Medicare Part A can be retroactive for 6 months. And so you could be using your Medicare Part A benefits and have a health savings account, so you're going to end up paying taxes on that. I learned that from the AAA. We'll talk about who they are. Medicare Part B, outpatient services. That's going to be your doctor services, your lab. That's the emergency room. If you go to the emergency room, that's outpatient. That's Part B. That is not Part A. That is Part B. And you definitely want to have Part B if you don't have any other coverage, because you can't go to the emergency room. You got to go straight to the hospital. But they're not going to put you in because they don't know what's wrong with you. So it's important to have Part B. It pays for diabetic supplies, preventive services, which this year, in 2023, the preventive services, the vaccines, they're all free as of January 2023. And for those of you who've had the shingles shot, you know that did not used to be free, and it's 2 shots, and a lot of people were having difficulty paying the cost of the shingles vaccine. Well, it's free. And these are I know you can't see it, but those are a lot of the preventive services, and let's just thank President Barack Obama and the Affordable Care Act for the majority of these preventive services. That's how we got them. Yes. The majority of them. There was always a flu shot and a pneumonia shot and all of that. But all of this other stuff, abdominal aortic aneurysm screening, alcohol misuse screening and counseling, obesity, behavioral therapy, welcome to Medicare, all that stuff. That's a part of the Affordable Care Act. Thank you, President Obama. All righty. What's not covered in Part A and Part B? This is why people sign up for Part C. It's because Medicare doesn't have dental, it doesn't have vision, it doesn't do dentures, it doesn't do cosmetic surgery, no hearing aids, no long-term care. But if you think about it, you could really just buy a separate insurance for all of that stuff and not put yourself in a managed plan, but people don't think about that. So those things are not covered. Dental, vision, and when I say vision, I'm talking about glasses, because Medicare does cover cataract surgery and ophthalmology and stuff like that. It just doesn't cover optometry. Okay. What you pay in 2023 for Part B Medicare? $164.90 a month. It went down. Last year was $170.10, I think. I think it's going back up. I read it, but I forgot what it is. I think it's like $166 for 2024. If you higher earning folks will pay more. So if you're making more than a single person, I think if you make more than $80,000 in retirement, then there's more that you'll have to pay. And a couple, if you make more than, I forgot what it is, but it's like $180,000, then you wouldn't pay the standard premium. All right, so the yearly deductible for Medicare, if you guys are listening to me, you're hearing a lot of expenses. People think, okay, I'm going to get Medicare, it's going to be wonderful, everything's going to be free. Now that's Medicaid. So that is not Medicare. Your yearly deductible in 2023 for Part B is $226, so you have to pay the first $226 before your Part B starts to work. And then your co-insurance is going to be 20%, zero for most preventive services, and 20% for outpatient mental health. So if you went to a Shoal Creek as an outpatient, then you pay 20%. All right, should I keep Part B? Should I sign up for Part B? Well, most people have to pay a premium. It's usually deducted from your Social Security check before you get it. The amount that you pay depends on your income, and if you have group coverage, you can delay it. And then there are some times that you have to have Part B. So these are the times: to buy a Medicare supplemental, to join a Medicare Advantage plan, to be eligible for TRICARE for life. Mr. and Ms. Griffin, you got to have Part B. To be eligible for CHAMP VA, which is kind of a disability program for veteran spouses. And if you work for an employer that has fewer than 20 employees, you have to have that. Okay. When medically necessary, Part A generally helps pay for all of the following. Hopefully they don't give you the answer. So these are the options: diabetic testing supplies, an inpatient hospital stay, an inpatient skilled nursing facility stay, or hospice. Which one does Part A generally help pay for, except for which one? Diabetic supplies, inpatient hospital stay, inpatient skilled nursing, hospice care. Part A. Diabetic testing supplies. So diabetic supplies are going to come from Part B, that's outpatient. So anything that's outpatient, you're going to use it in your house. It's a walker, it's a wheelchair, it's some oxygen. That's going to come from Part B. So that's going to be everything outside of Part A, which is all hospital stuff, pretty much. All right. In Part B, in most cases, you pay a monthly premium, a yearly deductible, 20% co-insurance. Which one? For Part B, a premium, a deductible, 20% co-insurance. That's going to be, you pay all of that. All of it. So a monthly premium, $164.90 for this year, a deductible, $226 for this year, and 20% co-insurance. The walker is $100, Medicare pays $80, you pay $20. So that's how that works. Okay. Medigap policies. Medigap policies are sold by private insurance companies. They only work with your original Medicare. Your original Medicare red, white, and blue card. Part A, Part B, and you can add Part D. Medigaps are going to be standardized. So they have letters, A through N or M, I think it is. And it's going to have the same benefit no matter who sells it to you. The difference might be what you pay for the cost. So if you sign up for a Medigap plan, say Plan G, well, you can look in Medicare and You, which I only have one of these, and I don't know why I only got one, but I was supposed to have a bunch of them. If you look at Medicare and You, and look at the Medigap plans, it's going to tell you all the benefits. You don't have to guess. You don't have to, I wonder if they pay for this. I wonder if they pay for that. You're going to know. The only thing that you're going to compare when you decide if you want to get original Medicare and I want to add a Medigap, is you're going to compare the price. That's it. Because the benefit's the same. So if you get Plan G from Conseco and you want to compare that to Plan G from United or Mutual of Omaha or wherever Jonathan's from, Colonial Penn, then it's going to be the exact same benefit. It's going to cover all the same things, and it's outlined. And really and truly, I don't know why more people don't do Medicare and a supplemental, because if you think about it, when you get the supplemental, you're paying a monthly premium. That's what you pay, and it could be as high as $80. It might be $150. But once you pay for the Medicare supplemental, you go to use your original Medicare and you give them that Jonathan's Colonial Penn card with it. You don't have any cover. You don't pay anything. Everything's covered. So all you've paid is you paid your Medicare premium, the $164.90, and you might have paid your Medigap premium, which might be $100 or however it is. But that's all that you're paying to have original Medicare and a Medigap. So just keep that in mind. All right, so those are Medigap plans. Do you need a Medigap? Well, it only works with original Medicare. If you have coverage from your employer, say you're going to have a group plan, you have Medicare, and then your employer is going to give you some type of group plan, you don't need a supplemental or Medigap. Can you afford the Medicare deductibles and copayments? Well, I'm going to say I can't, because if I were to go to a skilled nursing facility, which I hope I never do, but after day 20, that copayment is $175 a day. If I had a Medigap, I paid one premium for that month, and my copays are paid by that Medigap. So it's something to really consider. All right. And once again, Medicare when is the open enrollment for Medigap? It's limited. You can only do it at the beginning when you first turn 65 and you're enrolled in Part B, and then you have 6 months. If you don't get your Part B right away and say you have the group plan, then you have a special enrollment period for the supplemental or the Medigap. And during your open enrollment period for your Medigap, insurance companies can't say, okay, well, you have diabetes, we're not going to give you a plan. They can't refuse to sell you a policy. They can't charge you more because of a pre-existing condition, and they cannot make you wait for coverage. And if an insurance company wants to sell you one, they can sell it to you outside of open enrollment, but that's probably not going to happen. But if they say, okay, well, yeah, it's been 2 years since you were first eligible, and we're going to go ahead and sell you this plan, if they agree to sell it to you, then you can get it. All right, how do you buy a Medigap policy? Well, I helped somebody buy one. We went to Go Medicare, Go Medicare, and we did a plan comparison, and she ended up with Plan G, which pretty much paid everything except it's for some reason the plans no longer can pay your Part B deductible. They stopped paying that, and so Plan G pays for everything except for the Part B deductible. All right, let's check our knowledge. During your Medigap open enrollment period, insurance companies cannot refuse to sell you any Medigap policy they offer, make you wait for coverage, or charge more because of a past or present health condition. Which one? All of the above. Good job. All of the above. All right, so that's Medigap. Remember, it only works with original Medicare. If you have a Medicare Advantage plan, you don't need that. You can't use it. They can't sell it to you. So it only works with your red, white, and blue card with the bird on it. All right. Part D. Okay, Part D. That's the drug coverage. D as in drugs. We didn't get drug coverage until 2006. And it was like, ooh, yay. We got these people with diabetes. We can give them some diabetic supplies. but they can't get no medicine. So we used to run around South Austin Hospital, running to the doctor's offices trying to find some insulin and find this and find that because Medicare didn't have any coverage. But thank you, Jesus, we finally have it. So Part D is optional. You can choose it and add it to your original Medicare. If you don't choose it during the time that you're first eligible, you're going to pay a late penalty, and it's going to be added to your premium for the rest of your life unless you end up with like Medicaid or something like that. There is a formulary. So there are some things that Medicare will pay for and that it will not pay for. So you're more than likely not going to get cough medicine under your Part B because that's not really a prescription drug. The premiums vary, and these, once again, thanks to President Bush, these are private insurance companies that compete for your business for your Part D plan, and you really, really, really should compare them because I have had people. I was fortunate enough to be a Medicare Part D vendor with the area agency on aging when it first came out. So I have a pretty good understanding of it. So I've had people that were paying $95 to have a Blue Cross Blue Shield premium PDP, and then Blue Cross Blue Shield had the same plan that covered the same drugs that were $15. So you have to do your due diligence when you're working with Medicare and talk to people that know that can help you to make informed decisions. All right. If you do not have creditable coverage and you delay your original Medicare Part D sign up, then of course you're going to pay a penalty for that. All right, to join a Part D plan, you can go online. You can do a Medicare, the plan finder. Deacon Griffin's done it before. We started doing it together way back in 2006. We were helping people sign up for that. So you can do a plan comparison. There are also people that you can call that can help you, and I'm going to tell you who those people are at the end of this presentation. So the Medicare drug coverage is called what? Part what? A, B, Part D for drugs. That's right. All right. Now, Medicare Advantage plans, my favorite thing. Medicare Advantage plans, Part C. That's what Joe is trying to tell y'all to call about, and so they can check your zip code and see if you can get transportation and a food card and all of that. That's Medicare Advantage. It includes Part A and Part B, all the parts of original Medicare, and it may include Part D. There are some extra benefits, which is what people get excited about. You got an over-the-counter benefit. You got a flex card for vision, dental, and hearing. You have dental. You have these things. You might have transportation. They may have lower out-of-pocket costs. I don't know about that. So this is another way for you to get your Medicare, and it's offered by private insurance companies like Humana, like Cigna, like Aetna, like United Healthcare. They have to follow the rules of Medicare. So if you have a Part C plan, then you still have the benefits of original Medicare. You just turned your benefits over to somebody. And most of them have the drug plan included. So go right ahead. Oh, we need a mic. Wait, we'll get you a mic. It's on, I think. There you go.
My question is, where'd it go? So you can actually have someone manage your Medicare?
You sure can. It's called Humana, Aetna, United.
So what's the advantage of that?
Well, that's what I want you to figure out. We'll talk about it. And a lot of people that have group coverage, like people that retired from the state, they have United Healthcare. It used to be Humana because I worked with y'all. United Healthcare, Medicare Advantage. People that TRS has United Healthcare right now. For many years it was Aetna. And so you have to decide if there's an advantage. Is it an advantage or a disadvantage to have a Medicare Advantage plan? Some people don't have a choice. If you retire from the state of Texas, you're probably going to be in United Healthcare Medicare Advantage. If you retire from the state as a teacher, you're probably going to have United Healthcare Medicare Advantage as your insurance company. So you have basically what you have is what Kaiser Permanente started out being many, many, many years ago. I used to work for them. It was a great company. But you have a gatekeeper. The idea was supposed to be able to manage you into your best health so that you would do your preventive screenings, go do your colorectal cancer screenings, do your mammograms, all of that stuff before you got sick. But a lot of what it ends up being is you're fighting with your insurance company to go to St. Davis Rehab versus going to the skilled nursing facility. That's a lot of what you end up doing. So I'm going to let you decide. I work for an insurance company, so I'll let you decide. I'm not going to say it on the recorded line. Yes, ma'am. Okay.
Here you go.
Was told that I didn't have to sign up for Medicare at this time.
That's right.
Okay, good. And so
don't
no
have to.
penalty, still got hospital insurance, and I don't have to.
So once you retire and you end your group coverage, you have 8 months to sign up for Medicare. You could get A now because it's free, but you don't have to have either one of them. But you have that 8-month special enrollment period after you stop working or your group coverage ends. And there's a form. If you're going to leave, I'm going to give it to you.
Yes.
There's actually, you have to, your HR has to verify that you actually had coverage, so you have to.
She just had knee surgery.
Oh, okay. So now you can go online to apply for the Part B, but I also have that application. But this form has to be completed by your Human Resources Department, certifying that you had creditable coverage during the time that you did not have your Medicare Part B. Yes, ma'am, that's right. No, but you want me to, I'll come. Okay, get my information from Maryland. Okay, I'd be happy to do that. All right. Thank y'all for coming. So Medicare Advantage plans, maybe there's an advantage, maybe there's not. Maybe you want those over-the-counter benefits. You can just go to Walgreens and get you some over-the-counter stuff. And here's the other thing. Medicare pays these insurance companies to take care of you. So it's called capitation. So every month they're giving these plans money, money to manage you. And so a lot of times you may not get what you're being managed for. So I'm going to tell y'all who to call. All right, so that's the Medicare Advantage plans. So should you join one? Well, they offer some extra benefits. Some plans require you to be in a network. They all pretty much require you to be in a network unless you are in a PPO and you can go outside of the network, but you're going to pay more. You're going to have referrals to see a specialist, especially in a HMO, a health maintenance organization. You got to have a referral. And the doctor has to be in your network. And you can only join and leave during certain times. It does not work with the Medigap policy. So you decide, do you want to be able to make your decisions if the physical therapists say, okay, this patient needs to go to St. Davis Rehab, IPR, inpatient rehab hospital. And the insurance company says, well, we don't think that's where they need to go. We think they need to go to Park Bend. I promise you, you're going to spend about 2, 3, 7 days fighting with the insurance company to get to the St. Davis Rehab, and you're probably going to end up at Park Bend. We see it all the time, right, Karen? All the time at the hospital. Okay. So Medicare Advantage plans, these are the questions. Help you to pay for gaps in your original Medicare. Must keep the same providers all year long, or private plans approved by each state, or must cover all Part A and Part B covered services. Which one? There are private plans approved by the state, Medicare Advantage plans. They keep the same providers all year long. They help pay for gaps in original Medicare. The answer is going to be they must cover everything that Part A and Part B covers. There are actually private plans approved by Medicare, not by the state. So Medicare has to approve these plans. And there's a whole bunch of money in Advantage plans, and that's why they're fighting for people to join. That's why Humana has a whole TV station. I'm going to be on there one day talking about it. All right. And then there's help for people. Remember, we just talked about a whole bunch of money that you're spending out of your pocket to pay for all this stuff that you thought was going to be free. When you making the least amount of money you've ever made in your life, you're going to have to spend the most amount of money for Medicare. So, two programs I want to talk about. One is the Medicare Savings Program, and that's where you hear the people saying they looked up my zip code and they said I could get money back in my Social Security check. Well, they didn't have to look up your zip code for you to get that money back in your Social Security check. Your income just needed to be under $1,600 a month, and you could have called the state of Texas and got it. That's called the Medicare Savings Program. There are 4 of them. And a lot of people qualify for them and don't know that they're eligible. Probably none of you in here will ever qualify for it, but you might know some people that do. So that one will pay your Medicare Part B premium. And if you get what's called QMB, it'll also pay your deductibles and your co-insurance. I can't read those amounts, but it's under $1,600 for a single person, under something for a married couple. But that's extra. That's the Medicare Savings Program. You apply to the state of Texas to get this. And this helps you with your Medicare cost. You do not have to call Joe Namath or Jimmy Walker or the Medicare helpline hotline, because this has been around for forever. And then the other program is Extra Help. This is a really, really good one, because I spend pretty much all day talking to people about how to pay for Jardiance, Lantis, Eliquis, Xarelto, Trulicity, Toujeo, Ozempic. Those medications, you might start out paying $47 a month for with your Medicare Part D. But by the time you get to September, you're going to be paying about $1,000 a month, because there's something called the donut hole. And the donut hole, people are like, I never heard of that. The donut hole is when you and your insurance company together have spent $4,660, then you're in the coverage gap. And you're responsible for a percentage of the cost of your medications. Usually happens around September if you have one expensive medication. If you have 2 or 3, it might happen in April. But you're going to be in that coverage gap where you don't have any coverage. And then you don't get coverage again until you've spent $7,000, I think, $660, I can't remember, something like that. And so right now, we're talking to people at my work about why they're not taking their medications. It's because they can't afford them. And so I talk all day, every day to people about, did you know you could, well, let's see, do you qualify for extra help? What's your income? Oh, I get $900 a month. Oh, wait a minute, let's do this application. So we do an application online, straight to Social Security, 3 weeks, they get approved, and now they're paying $10.35 for 3 months supply of Eliquis. Or they don't qualify, so okay, wait a minute, hold on. Let's see, let's call Johnson & Johnson or Janssen. Let's call Novo Nordisk. Let's apply to Sanofi. Let's apply to AstraZeneca. And the people get the medications for free. But people don't know that. So a lack of information is causing a lot of people not to be able to meet their health care needs. And so this is why we do what we do, to encourage people to ask questions, call this person. Do not call the hotline or the helpline, because you're not going to get the right information. And so if you know anybody that's struggling to pay for a medication, whether they qualify for extra help or not, they could apply to the drug company if they have Medicare, except for not for Trulicity right now, because there's a hold on that one. But pretty much everything else, you can get it for free. So, yeah, well, Medicare people can't use coupons. No, they cannot, but you sure can get some free medication. That's even better than a coupon. So, all right, so key points to remember. Medicare is a health insurance program. It's not social services. It's not the welfare office. It does not cover all of your health care needs. You have choices in how you get your coverage. Decisions affect the type of coverage that you get. Certain decisions are time sensitive. So there are penalties for, not being in your enrollment period, not applying when it's your time to apply. And then there are programs for people with limited income and resources. Now, the Area Agency on Aging. I want you guys to write this number down. It's going to be on the next page, and I know y'all can't read that, but this is another fabulous agency that president from the great state of Texas also put into existence. The Older Americans Act of 1965. It was revised in 1973, and it established state area agencies on aging to help people on Medicare and Social Security understand benefits. And not only does it do that, it does things like congregate meals, home delivered meals, blah, 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 care coordination. But the most important thing is this is who you call when you have a question about your Medicare. Please don't ever call a number on TV. You are going to get swindled into something that you don't know that you are signing up for. Oh, yeah, they said I had a Medicare supplemental. Ma'am, that is not a Medicare supplemental. That's a Medicare Advantage plan. It's not the same thing. Ma'am, you have Medicaid. Why do you need anything other than just regular Medicare? So, benefits counseling. It's free. It's confidential. These are people that do not work for insurance companies. Their only job is to help you to make an informed decision. And as I said earlier, I called them myself because I'm like, what about this? I read something about this health savings account. And Ann, I think that was her name, a few months back, she was like, let me look into it. She called me back. Yep, you have to stop putting money into that 6 months before you get your Medicare. So I've used them. They're very knowledgeable. They can help you with Social Security, with Medicare, with Medicaid. They can help you with like Medicaid estate planning or guide you to the person that can help you. And it is free. Now, if you start calling them around open enrollment time, it's going to be a minute before they get back to you because everybody else is calling them. But these are the people, and on the back of this book, which I only have one, and I don't know why, Medicare and You, this is a Texas book. This is specific for Texas. On the very back, it says the SHIP for Texas. Rans is for you. SHIP for Texas, Health Information Counseling and Advocacy Program. The phone number is on there. And I have the phone number right here. That's the local number, 512-916-6062. There's also a 1-800 number. But if you call this person, call and ask to speak to the benefits counselor. Ma'am, 512-916-6062. They are located on Burleson Avenue. I've been over there many a time picking up materials. Now I just get my own straight from Medicare, but I've been over there before. And the benefits counselor is there. I think they have 2 now. As a matter of fact, we had the benefits counselor come here a long time ago. Y'all probably don't remember when Medicare Part D first started. We were in that fellowship hall with the seniors probably 15 years ago. They came and spoke to us about what Medicare Part D was going to be about. But this is free counseling. It's confidential. It's going to help you to make an informed decision. They're not getting paid if you sign up for Humana. Those people that are talking to you on the phone are getting paid. That's why they're talking to you on the phone. There's money in that. So the more people they sign up, the more money they make. So you don't need to call Joe. You don't need to call Jimmy, Danny. Don't call anybody. Ghostbusters. Don't call. Just call the SHIP. The number's on the back of this card. The 1-800-252-9240. That is the Area Agency on Aging Benefits Counselor, or the SHIP, and they can help you. Oh, the number 1-800-252-9240. When you call that number, ask for the benefits counselor for Medicare, and they will help you to understand, sign up for a plan if you want to, explain why you might want to have a Medicare Advantage. I don't think they'll do that. Medicare Advantage versus traditional Medicare. Talk to you about the cost, but that's who you should be calling. These are the people. So that is really all I have. I hope I answered some of your questions. I have time for maybe 1 or 2 more questions, but as I said, Medicare is complicated, but it doesn't have to be that complicated because there are people that President Johnson put in place to help us all to have a better understanding of Medicare and what it offers and what to do and what not to do. So does anybody have any questions? Okay.
What is the real difference between Medicaid and Medicare?
Between Medicare and Medicaid?
What is the real difference between Medicaid and Medicare?
It's a big difference. So Medicare, you qualify for Medicare based on having you or somebody in your family having paid into the Social Security system. Medicaid is a welfare program. So it's always based on your income and your resources. It's possible for you to get Medicare and Medicaid at the same time, but anybody that gets those usually has a limited income. So Medicaid is it's a welfare program, basically, based on income and resources. And in Texas, to get regular Medicaid, your income has to be about $1,000, something like that. And that's, well, go ahead.
Thank you. Okay, so I don't know, I came in kind of late, but I do have a question. So next year I will be turning 65. I am retired with the teacher retirement system, and right now I pay for Blue Cross Blue Shield TRS. When I turn 65, will I still have to be under Blue Cross Blue Shield in Medicaid, Medicare?
No, you're going to have the state retirement program or teachers retirement program, which is going to probably United Healthcare. Is United Healthcare Medicare. That's what you're going to have. But now keep in mind that TRS does have some carved out benefits that are specific to TRS. One of those is transportation. A lot of people don't know that. That comes straight from TRS. So for the retirement plan for teachers right now, it's United Healthcare. A couple of years ago it was Humana. That's how I got hired on. But right now it's United Healthcare. It's not Blue Cross Blue Shield.
Okay, and will I still have to pay a premium per month for that service?
It depends on if you paid into Social Security or not.
I did.
Yeah.
I did pay into Social
Yeah, so
Security.
talk with your administrator, your benefits administrator at TRS to figure out exactly if you're going to have to pay a premium or not. Some people do. If you've paid the 10 years into Social Security, you probably won't. Not for Part A. You'll have Part B premium,
But
though.
Part B,
but
I
not
will
Part
have
A.
a premium.
Yeah.
Okay. And then I can also get all those supplementals and all of that. And
You're going to have a Medicare Advantage plan, I do believe, so you won't need it. You can't get a supplemental.
okay.
United Healthcare, right now, what TRS has is United Healthcare. It's a Medicare Advantage. You can't get a supplemental with that.
Okay.
You can only get a supplemental with original Medicare,
All right. Thank
which
you.
is what Jackie's going to get. I told her about that.
Thank you.
Anybody else? Yes, ma'am. Okay.
What does PPO actually stand for?
PPO? Okay. PPO. So,
PPO. What does it mean?
okay, so when you're looking at your insurance, there's different kinds, but the most common ones are HMOs and PPOs. So a PPO is a preferred provider organization. That pretty much means that you can go out, you can see the doctors in that network of providers for a certain amount, and you can go outside of that network. You might have to pay a little bit more, but you can go outside of the network that you're in. The other thing is that in a PPO, you don't usually need a referral in a PPO. In a health maintenance organization, you're going to be assigned a primary care doctor, and that person's going to be the gatekeeper. So if you need to go see the endocrinologist, the gastrologist, whoever, the primary care doctor in an HMO has to make a referral for you. So a PPO is actually, if you're going to be in a managed plan, I would be in a PPO versus a HMO. I would. That's why you're going to call the area agency on aging, and you're going to talk to the people, the benefits counselor, and they're going to answer your questions. And it's going to be one-on-one. It's just going to be you and them. You can ask any question that you want to ask. Anybody else? Y'all confused? I tried to make it easy. All you got to remember is you got Part A, Part B, Part C, and Part D. Part C combines A, B, and D. That's it. Part A and B, you add the Medigap supplemental if that's what you want to do, and you add a Part D. That's basically it. Well, think about it. So I said private insurance.
Can you repeat the question?
Oh, can you repeat the question? Oh, can I repeat the question? What was my question? Oh, you said why do they have so many different variations?
Correct.
Well, this is America. Capitalism is alive and well. That's why. That's the real answer. That is really the
Well, I
really
mean,
the answer.
And the reason why I'm asking the question because it seems like there's already a problem with, of course, capitalism being not very forego. I'm gonna say that in regarding to the information they want to provide, and so you have folks who are at this age are being hit on a regular basis with misinformation
Yep.
and implying things that's not necessarily for their best interest. So I'm trying to figure out what is the advantage of certain things, when you have all these different plans. I mean, I thought at first maybe the plans were associated based upon your health and your health needs, but it's not necessarily that. So how do you make a determination what I want to get now, because you don't know what's going to happen
Right.
in the future for you. So it's really, this is so
You
confusing.
just want to decide.
Like a science project or something.
Do you want to be frustrated in your process of navigating the healthcare system, or do you want to make it as easy as possible? In my estimation, the easy way to use Medicare is to look at this book right here. It's going to tell you everything that Medicare covers. It's going to tell you how they cover it, how much of it is covered. Medicare and you. I have to order some more. I thought I had ordered some. Apparently I didn't. But I'll get you one. And you can also download it from Medicare.gov. But here's the thing. If you want to be frustrated, and if you want to have a peer-to-peer with the medical director and a peer-to-peer with the family got to talk to the doctor about why your mama need to go to the IPR, then sign up for a Medicare Advantage plan. If you want for the physical therapist to say, okay, Ms. Dozier, you need to go to the rehab. And they say, oh, she got regular Medicare and a Medigap Part Plan G. I'm going to pack up my bags. Well, they're going to pack them up because I'm going to be rehabilitating. Pack up my bags, and I'm going straight to St. Davis or the Central Texas Rehab. That person that has that Medicare Advantage plan going to still be in the hospital fighting with the medical director of the insurance company. And we might have the exact same thing, medically, but our insurance is different.
So treatment really is determined by the coverage.
Very much so.
Well, the recommendations are not determined by the coverage that you have. The recommendations are going to be the same. The therapist saw you and said, this is what you need. Now, when we look at, okay, she said they want to go to the rehab hospital. I'm like, okay, first thing I look at, what's the insurance?
Right.
Then I say, they ain't going. Or they'll go in 5 days if they go at all.
Okay.
So that really, it's just like with your regular insurance, your commercial insurance. If you need to go somewhere or get something done, you need a referral. You need a MRI. They got to give you a referral. You need to go to the rehab hospital. They got to agree that you need to go to the same thing. It's the exact same thing. But do you want that? I don't.
Thank you, Sister Dozier. I appreciate you sharing this information. My question really and comment, how much information do we publish for people to get this information in the context of, the church? Because as our congregation ages, I think this information is important, particularly during the open enrollment period, where we publish information in the Pulse. But not everybody received the Pulse, but so that we make it as available as possible. So I thank you for your work today. Here.
Thank you, Deacon Sanders. Thank you, Deacon Sanders. I appreciate you. So, as I said, you do have a resource. It's the Area Agency on Aging. You also have me. I don't know everything about Medicare, but I've been doing it long enough to know don't do that. So if you have questions, people call me. Yes, ma'am. Oh, it's off.
So my question is, and maybe you already said this, if a person is already enrolled in Medicare and they want to make some changes, then they have to wait till open enrollment to make the changes.
Open enrollment. So the open enrollment starts October the 15th, goes through December the 7th. So whatever you can change to a Medicare Advantage plan, you can drop a Medicare Advantage plan and sign up for just regular Medicare. And then whatever you pick goes into effect January the 1st. So it's a year-to-year thing. So, and then.
Blowing it up.
So what?
starting next week, the telephone at home is going to start blowing up
Well,
with people
that's
calling
fine.
to change us, right?
Right, yeah, right. That's fine. I don't mind answering questions.
I have one more quick question,
Yes,
Jackie.
yes, ma'am.
If you should sign up with someone and then you want to stop it, how do you do that? How do you get out of a plan? Is it easy to do?
No.
Okay.
So, and I'm going to tell you why. So if you so right now, say during open enrollment, you decided I'm going to sign up for United Healthcare. Well, it doesn't go in effect until January. So you could change that during the open enrollment. You could okay, I don't want that. I want Aetna. Okay, but once open enrollment once the regular year starts, January the 1st, you cannot, well, let me take that back. For Advantage plans, there is a time that you could change. If you decide I don't like this Medicare Advantage, you can get out. But routinely, you're locked into what you have picked unless there are two things that could happen. You move out of the area and that plan's no longer there, so you have to choose another plan or go back to regular Medicare. Or you have a Medicare savings program, the one that helps you with your cost, or you have Medicaid, or you have the extra help. You could change. It used to be every month. Now you can change once a quarter. But that's not going to be a whole lot of people in this church that have those kinds of benefits. But routinely, you're just locked into it unless your plan moves out of the state, or you move out of the state, or it's during the Medicare Advantage open enrollment period. So, yeah.
Talk a little bit about formularies.
Formularies. Okay, so remember I said that Medicare didn't have prescription coverage until 2006. And so pretty much Medicare is going to cover most of the basic stuff that your commercial insurance covers. So it's going to be your insulins. It's going to be your pain medications. It's not going to be stuff that's going to be over the counter. But you do want to compare. Like if you have just a Part D plan, you want to compare how they cover a drug versus how another Part D plan covers it. Because one plan may say, well, we want you to try this, this, and this before we'll let you have that. The other plan might say, well, you can go directly to that. So the formulary pretty much is the same for the plans. It's just how you get the medication might be different. You might have to do step therapy, or you might have to try this first, that kind of thing. But always, every year, even if you're not changing your plan, do a plan comparison just to make sure. But people that have like regular Medicare and TRICARE, y'all good, because y'all have your prescription coverage is with TRICARE, so you don't have to have a Part D plan. If you have VA benefits, so you're VA disabled, you might not have to have a Part D plan. I have a lot of veterans that I work with that they have the insurance that I work for, but they don't have the prescription plan because they don't need it because they go to the VA. So, everybody's situation is kind of different. You just have to decide what's the best thing for you. But if you don't have any insurance, any prescription benefit, you need to get Part D, even if you just get the cheapest plan out there, even if you don't take any medications. Because what happens is, okay, I don't take anything. I didn't sign up during my initial enrollment. Now I'm on Eliquis, and I need to get that medication. Well, you're going to pay a penalty for not having signed up during the time that you were eligible. And the only time you could enroll would be during open enrollment. So, you have to really think about it. If you don't have prescription coverage, you need to have prescription coverage through Part D.
In the chat, Dr. Martin said, great presentation on Medicare.
Thank you.
And she also said that before she chooses her Medicare Advantage programs, she asked whether her current doctors are included in the program.
That's very good. She's exactly right. So you have to make sure that the doctors that you want to see take the plan that you're signing up for. So if you go to Medicare.gov, you go to the plan finder, you can put the doctor's names in to make sure that they're actually in network with that plan. Which is why, if you have regular Medicare, you don't have to worry about it because every doctor is in network with Medicare. It's not a network. They just take Medicare. So, but that's a good point, Dr. Martin. You're absolutely right. Make sure your doctors are in the network that you're choosing. Anybody else? The majority of doctors take Medicare. There are some that they call themselves concierge doctors or something like that. They don't take insurance either. But the majority of doctors in the United States take Medicare. They don't take Medicaid, but most people take Medicare. Is the largest health insurance insurer in the country. So they would lose money if they didn't take Medicare. Yes, ma'am.
Will you repeat which plans are included in the advantage?
Which plans?
Did you say A, B?
Oh, so parts of Medicare? So most of them, it's always going to have A and B. You have to have A and B to get a Medicare Advantage plan. And then you could have the Part D included in that plan, but there are also some Advantage plans where you pick a standalone Part D. I've seen that too. But basically, the Part C, Medicare Advantage plans, include A, B, and D routinely. Yeah, so the drug plan, the hospital insurance, and the Part B. And make sure that when it's time to get your Part B, you get the Part B, because if you don't have the Part B, you can't go to the emergency room. You got to go straight to the hospital. You can't get your walker. You can't go to your clinic. You know, you can't get home health care. So Part B, even though it's expensive, a lot of people won't take it because it's $164. Well, you need that. You have to have it. So you have to have A and B. And like I said, if you have group coverage, you may not need the drug coverage from Medicare because you might have it from your retirement or your job or whatever. So, all right, y'all. I'm tired. Y'all tired? Y'all have any other questions? I'm tired. Thank you, thank you, thank you.
She did an awesome job, and the one thing is being informed about what you need to do. And then, as she has said, there are agencies out there that can help you walk through the process. So again, let's give Miss Jakki Dozier a hand. This presentation will also be live on David Chapel's line on YouTube and on Facebook and on the website. So you can go back and see it again if you missed some of the information that you did not receive. And share with your friends, because we are a heart for the community. The other thing I wanted to share is that there'll be other events that will be happening here at David Chapel, and our next one will be on October 14th. Many people are not looking at your wills, your trust. What do you need to do if somebody was to die? Or what do you do if a family member is close to you that died? So we will be having that information happening here at David Chapel. The presenter is Ms. Stephanie Liu, attorney, Bloomington Law, PLLC. It's going to be October 14th from 12:30 to 2 p.m. If you have people who need to know this information, please let them know. We've seen a lot of deaths that have happened here at David Chapel, and people were not prepared. So again, October 14th, tell your friends, people who need to know about wills and trust and what to do. And it will also be live streamed again. So thank you again for coming. We are so excited to bring this information to the community as well as our members here at David Chapel.
What time will that be here?
It's going to be from 12:30 to 2 p.m., October 14th. Again, thank you. Yes. Another question? Okay.
Dr. Martin is asking, is there a maximum out-of-pocket for the patients under Medicare Advantage?
Okay, that will be for Sister Jakki.
And that answer would be yes, there's a maximum out of pocket, and it's included in the plan that you sign up for, so it varies. They tell you what that maximum out of pocket is. But if you compare the Medicare Advantage to the Medigap, you might see that it might make more sense to just do a Medigap. But the plans, so Medicare Advantage plans, Humana might have 15 plans in Austin. United Healthcare might have 25 plans in Austin. Cigna might have 30 plans in Austin. So you have to compare the plan from the insurance company. But they'll always tell you what the maximum out-of-pocket is in the benefits grid, how much you can expect to pay out of your pocket. It's usually going to be like, most of the times, average about $7,000, $8,000. It's what I've seen out of pocket.
Thank you all again for coming and hearing this information that we have. And we will have many more sessions, as I've said before, here at David Chapel in Texas, Austin, Texas, and also streaming online. So thank you again. And thank you again, Sister Doe.